Preauricular pits are small holes located near the front of your ear. They are tiny indentations or tracts that can be found just where the ear cartilage meets the face. They are present at birth, meaning you're born with them. These pits are congenital, which means they develop before you are even born. These tiny pits form while a baby is growing in the womb. During the early stages of fetal development, the ear structures are forming and sometimes these pits appear. Sometimes the ear doesn't fully develop, leaving behind these little openings. This incomplete fusion of the ear hillocks results in the formation of preauricular pits. Most preauricular pits are harmless and don't cause any problems. They are usually just a minor cosmetic issue and don't affect hearing or ear function. They are a common birthmark and many people have them. In fact, it's estimated that around 1 in 100 people have preauricular pits. Think of it like this. Imagine your ear forming like Play-Doh. As the ear takes shape, sometimes small imperfections can occur. Sometimes a tiny bit of the Play-Doh doesn't quite smooth over, leaving a small dent. This is similar to how preauricular pits form. That's kind of what a preauricular pit is like. It's a small, harmless imperfection that many people have. These pits are usually on one side of the ear, but some people have them on both sides. While they are more common on one side, having them on both ears is not unusual. Preauricular pits are easy to spot. They look like tiny holes, almost like someone poked the skin with a pin. You'll find them at the top of your ear, right where the ear meets your face. They can be very small, almost unnoticeable, or a bit larger and easier to see. While most preauricular pits don't cause any trouble, some people might notice mild symptoms. The area around the pit might feel itchy sometimes. This is usually nothing to worry about, but scratching should be avoided. While generally harmless, preauricular pits can sometimes become a little troublesome. The pits act like a tiny tunnel under your skin. Sometimes this tunnel can get infected. If the pit gets infected, it might become red, swollen, and tender to the touch. You might also notice some discharge, like a white or yellowish fluid coming from the pit. If this happens, don't panic. Your doctor can easily treat the infection. They might prescribe antibiotics to clear up the infection quickly. Section 4. Treatment options. What to expect. In this section, we'll walk you through the various treatment options available for preauricular pits and what you can expect during the process. Most of the time, preauricular pits don't need any treatment. They are usually harmless and don't cause any issues. They're just a part of you. Many people live their entire lives without even noticing them. However, if you experience frequent infections or discomfort, your doctor might suggest a more permanent solution to prevent future problems. A simple surgical procedure can remove the pit and the small tunnel under the skin. This is often recommended if infections are recurrent. This procedure is usually very quick and straightforward, done on an outpatient basis. You won't need to stay overnight in the hospital. Don't worry, it's not as scary as it sounds. The medical team will ensure you're comfortable throughout the process. You'll receive local anesthesia, so you won't feel a thing during the procedure. The area around the pit will be numbed completely. Afterward, you might have a small bandage for a few days. This helps protect the area as it heals. Your doctor will provide you with post-operative care instructions to ensure a smooth recovery. Follow these guidelines carefully to avoid any complications. Most patients can resume their normal activities within a few days. It's a minor procedure with a quick recovery time. With the right care, you'll be back to your routine in no time, feeling relieved and confident. Section 5. Caring for your preauricular pits. Caring for your preauricular pits is easy and straightforward, but it does require some attention to detail. The most important thing is to keep the area clean to prevent any potential infections or irritations. Gently wash the area around the pit with soap and water when you wash your face. Make sure to use lukewarm water, as hot water can dry out the skin. Avoid using harsh soaps or scrubbing too hard, as this can irritate the skin and potentially cause more harm than good. Opt for a mild, fragrance-free soap. It's also a good idea to avoid touching or picking at the pit. This can introduce bacteria and lead to infections. You don't want to introduce any bacteria that could cause an infection. Always wash your hands before touching your face to minimize the risk. If you notice any redness, swelling, or discharge from the pit, see your doctor to get it checked out. Early intervention can prevent complications and ensure proper treatment. After washing, you can apply a gentle moisturizer to keep the skin hydrated. This helps maintain the skin's barrier and prevents dryness. With these simple steps, you can keep your preauricular pits clean and healthy, ensuring they don't cause any issues in your daily life. Section 6. Living with preauricular pits. Living with preauricular pits is generally very easy. Most people don't even think about them. They are a harmless birthmark and don't affect your health in any way. Remember, if you have any concerns about your preauricular pits, don't hesitate to talk to your doctor. They can provide you with personalized advice and address any questions you may have. So if you have preauricular pits, embrace your uniqueness. They are a part of what makes you, you.